We all know to avoid people who are coughing and sneezing, but there's also a worry about so-called silent spreaders, people who are showing no signs of coronavirus at all, but can still pass on the virus.
Osterholm is director of the Center for Infectious Disease Research and Policy at the University of Minnesota.
We now have conclusive evidence that this disease is also being transmitted through asymptomatic carriers, or people who show no symptoms. It's like trying to stop the wind.
And this study, which has yet to be peer-reviewed, found that in Singapore and in Tianjin, a city in China, infection was transmitted about 2 to 3 days before symptom onset. And that makes the outbreak much more difficult to control.
Asymptomatic carriers are clearly a way that this spreads, right? There's no ifs, ands, and buts about that anymore.
You may be an asymptomatic carrier of COVID-19. Well, what does this mean for you? This means you can pass COVID-19 on to someone else, possibly for up to 3 weeks. And we also know that even if you're an asymptomatic carrier, you can still pass on the full strength of COVID-19 to someone else. Just because you don't have symptoms doesn't mean that you're carrying a less or weaker form of COVID-19. You're carrying the same strain, so be very careful.
It's very important to know when a person is infectious with COVID-19.
This graph is taken from a paper by Gabriel Leong and coworkers published in Nature Medicine. They found that infectiousness starts 2.3 days before symptom onset, that patients are most infectious 0.7 days or around 1 day before symptom onset, and that 7 days after symptom onset, there was very little infectiousness going on anymore. They also found that 44% of infectiousness or infections occurred in the pre-symptomatic phase, and that's really bad because it makes containment very hard.
A UTSA professor has been studying the transmission of the coronavirus around the world. He says carriers of the virus who aren't showing any symptoms could be spreading it without knowing it. Eyewitness News reporter Vanessa Croy, why people need to pay attention to this silent threat.
A video by the Cy-Fair Fire Department simulates how germs are easily spread by just a cough.
It hangs in the air.
Droplets that linger in the air and cover surfaces. But what if someone coughs or sneezes and doesn't know that they're carrying the coronavirus?
It's extremely contagious.
UTSA mathematics professor Dr. Juan Gutierrez said asymptomatic carriers are a silent threat, driving the spread of the virus.
Seeking sort of medical attention, and they might be transmitting the pathogen.
National studies estimate that one person has the potential to spread the virus to 3 other people. But Dr. Gutierrez said research doesn't take into account asymptomatic carriers.
In 3 months, one pathogen has covered the planet.
After studying transmission in 13 other countries, he found one person could spread the virus to an average of 15 other people.
People need to take this pathogen very seriously.
Well, that's our greatest fear, is that patients who have COVID-19 are contagious, are spreading it without their knowledge.
As many as 25% of people infected with coronavirus may never show any symptoms. That's according to CDC Director Robert Redfield.
This virus is going to be with us.
In an interview with NPR, Redfield explained people without symptoms still contribute to the coronavirus spread. Slingshot Health founder Dr. David Berman has watched seemingly healthy people pass along COVID-19 with serious consequences.
Son-in-law's grandfather died Friday from COVID-19, age 92, because his home health aide worker brought it in, had no idea she was infected. She feels terrible.
无症状感染者也是一个我们要非常重视的问题，因为无症状感染者他本身有传染。
I think it should be clearly publicized and emphasized and re-emphasized time and time again. The barriers to testing should be none.
We can't just be testing people with symptoms. We have to start going to the broader public and start testing as many people as possible, asymptomatic people.
In fact, Ford says a new plan is coming next week, focused on random testing, including people who show no symptoms. In Alberta, meantime, they're already testing more aggressively, asymptomatic tests in Brooks and Calgary, where there have been outbreaks.
Saskatchewan's testing capacity is relatively high, but demand is low. So starting Monday, the government will expand its criteria to include anyone working outside the home. No symptoms necessary. Infection control specialist Colin Furness applauds Saskatchewan's plan.
We need to be worried about contagion where people don't seem sick. That's actually what's most dangerous. So
he argues provinces should go even further.
We should be testing grocery store workers. We should be testing taxi drivers and transit operators, as well as frontline health folks. They're the canaries in the coal mine.
Last week, Alberta introduced testing for asymptomatic people living in Calgary. 3,400 people got tested. More than 100 had the virus.
As for the fix, Ford is promising much more widespread testing.
Let's go covering every Uber, every taxi driver, every limousine driver. Let's get them tested. Let's go into the food manufacturing facilities, these large facilities, get them tested.
Nationally, the Prime Minister is offering what he calls massive support.
We don't want logistical or financial limitations to keep anywhere in this country held back from doing all the testing that is necessary.
He says with federal help, he hopes to see an improvement immediately.
So we have increased our capacity quite a bit. We were about 7,000 a day, but I think the capacity and where we test and who we test are different things. So we don't want to, right now there's no value that we're aware of anywhere for just randomly testing asymptomatic people in the community.
Next question is from Eva Yuguen from CBC. Go ahead, please.
Hi, Dr. Henry, you mentioned we might be playing catch up in some of the outbreaks at long-term care centers. In order to try to get ahead of the outbreak at South Granville Park Lodge in particular, shouldn't all the healthcare workers and residents there now be tested for COVID-19?
The testing, unfortunately, doesn't tell us the whole story. People can be negative 1 minute and positive within an hour. The test itself is not as sensitive as we expected it to be at the beginning. So we now know that about the false negative rate can be as high as 30% early on in infection. So we still, the norm is not to test people who do not have symptoms, because we know the test doesn't perform very well and we can have false negatives.
One of the scariest aspects of COVID-19 is showing up in the worst of possible places.
Mass testing revealed employees at a long-term care facility had the disease but showed no symptoms. Susan Elizabeth Littlefield explains how this data could save lives.
Johanna Shores is one of the largest multi-tiered senior homes in the Twin Cities. On Friday, National Guard medics tested 545 residents and staff members. None had any symptoms, but 5 residents and 23 workers all tested positive.
I really respect the transparency of Johanna Shores, that we're told that as people who have family there.
The director of Johanna Shores talked with WCCO.
Were people surprised to find out they were COVID positive?
Yes. They had no symptoms at all, so they had no idea that they were potentially a carrier.
After getting the results, Justin Berkeley says they immediately sent infected workers home.
We have an amazing team here, a very dedicated staff that was willing to step up and try and cover it for the next period of time.
Berkeley says staff were already wearing face shields, but this new information is key.
We were able to quickly identify those staff members that were asymptomatic, so then we would be able to, again, minimize any further spread or exposure to our residents or to our coworkers.
Johanna Shores was among the first in Minnesota to get community-wide testing. It's part of the state's new plan to stop COVID in care homes. And it's given Annie Glenn's daughter a new mission.
If there was anything I could do to spread the word that everybody needs to push for more testing, I would do it.
What can we learn from history? The worst pandemic in modern history, the Spanish flu, which is estimated to have infected a third of the world's population, had 3 waves of infection. The first wave was in the spring of 1918, while the second wave happened in autumn that year. The third wave occurred a few months later, which lasted till the spring of 1919. You can see the pandemic peaked in the highly fatal second wave, which was responsible for most of the deaths. Many health experts have said that history may repeat itself. The World Health Organization has warned that the worst of the COVID-19 pandemic is yet to come.
The president of the Canadian Medical Association says Canada is not ready for a second wave of COVID-19. Dr. Sandy Buckman told a Senate committee yesterday Canada is taking a gamble by reopening.
In my opinion, we're not fully prepared for a second wave. You know, if we don't have adequate diagnostic testing, so original testing, disease testing for people who have the disease, and we are doing insufficient contact tracing.
We badly need to work out how we can reopen parts of society safely. And experts say that really means one thing.
Every public health official says, testing, testing, testing.
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 But those experts are right. In managing a pandemic, there is almost nothing more important than widespread effective testing. It is your only chance of tracking and containing the spread from the start.
These are the keys to containing the silent spread of COVID-19. If the leading health authorities in your area are not doing these things aggressively and consistently, you need to ask them why. I hope this presentation has been helpful. For more information on this and other COVID-19 issues, please click on the link shown below this video or visit ronaldnhughes.wordpress.com. Stay safe, my friends.